Howdy, I'm Becca.
I'm Gracie.
I'm Elliotte.
Rene.
I'm Abby.
I'm Bianca.
Our group chose to focus on the topic of female and male masturbation. This is a topic that for hundreds of years has been avoided by public conversation due to either cultural values or religion or even parental influence. We, as healthcare providers, must explore this issue to gain a better understanding of our anatomy, social views, and to improve healthcare services for patients. Masturbation rates are different among the sexes, and there are many gender stereotypes that are still held today, like the belief that only men enjoy masturbation. Previously, research conducted on masturbation has revealed that self-pleasure can lower one's anxiety, stress, and can even help to relieve pain. It is still a guarded subject among the general population. However, in recent years, it has gained traction and been more openly discussed and freely talked about.
Through our research, we hope to learn why there continues to be such a stigma associated with masturbation, especially female masturbation, when so many other things have become accepted in society. We wanted to discover the advantages and disadvantages that are linked to masturbation, and if there are more cons than pros. And finally, we wanted to know if our youth is being educated on the topic of masturbation, and if not, why. In order to discover these answers, we not only did research, but also sent out a survey to our fellow peers. We had responses from college-aged males and females on a variety of open-ended and closed-ended questions. We asked about their age, sex, sexual orientation, relationship status, and then we asked about the number of times they masturbated per week, their reasoning for masturbating, if they are able to talk to their friends about masturbation, if they use porn while they masturbate, how they view female masturbation versus male masturbation, and finally, how their upbringing may have affected their outlook on masturbation. As shown on this PowerPoint slide, we had more female responses than males, but this did not negatively affect our research because the responses still showed the differences between female and male masturbation. Our survey responses showed that while the majority of females responded that they do masturbate, the rates of male masturbation was higher. Females are also more likely than males to keep the topic of masturbation to themselves. We saw that a large majority of all responses stated that they masturbated for stress relief, relaxation, and to explore their own body/sexuality. And there was an overwhelming response from everyone that said male masturbation is seen as normal and female masturbation is not.
During our survey, we had about mostly ages 19 to 23, with the majority of them being 20 years old. And then most of our female respondents were the majority of who answered the questions. Most of the respondents were single, and most of them were also heterosexual. Most of them, there was an even split between who masturbated with pornography, without pornography, and then who had sometimes used pornography and sometimes have not. Most people masturbated between 1 and 3 times a week. Most people did feel comfortable talking about masturbation with their friends and didn't have like an awkward or uncomfortable feeling. And then most of the reasons people masturbated was for stress relief, exploration of their own body, and relaxation.
For our first open-ended response, the question was, how has your upbringing affected your views on masturbation? A little under half of our participants were unaffected because it was something that wasn't spoken of with their families, or because it was something that they thought they should figure out on their own. The other half of respondents said the topic was something they viewed as sinful or bad or shameful. And the second question was, what are your views on female masturbation versus male masturbation? Most of our respondents said that they thought male masturbation was something that was more open and free to talk about, and it was more normalized compared to female masturbation. And female masturbation was seen as something that was dirty, shameful, or unspoken of. A few of the respondents said that it was something that should be treated the same because they were both the same, because they're both from people that are normal people, and it's something that's natural.
We learned several key things throughout our research. First of all, we learned that a significant amount of people were open to the practice of masturbation instead of the idea that people weren't okay with masturbation or weren't comfortable with doing it. So that was contrary to our original beliefs. We also learned about the specific influences on individuals' personal thoughts of masturbation, and we found that the two most common were family relations and their religious upbringings. Lastly, throughout our research, we identified a handful of common misconceptions about masturbation. Some of these being the thought that males who masturbate too much might become infertile, the idea that only men masturbate or only men enjoy masturbating, or the idea that there are no benefits at all to masturbation. And of course, we found that these were all false. We did have some difficulties, and there are always difficulties when conducting research on human sexuality. First of all, there's a difficulty in just creating the questions. When you're creating questions for surveys on human sexuality, you have to make sure that in the wording of these questions, you're articulating the questions and what's being asked in a way that it doesn't confuse, upset, or shame the participants in any way. The other difficulty is that sometimes participants aren't very open with talking about stuff like this. So for our instance, masturbation, some individuals may shy away from or feel uncomfortable with answering some questions honestly. And this can cause discrepancies or even a lack of results at all in our conclusions.
Next, our group noticed a few surprises with the free response questions, while the closed-ended ones were kind of as expected. We saw that half of the participants' parents never spoke to them about sexual activities, therefore masturbation was never spoken about, which comes as a surprise because you think that most parents would have a discussion with their children at some point in their life. However, when it was discussed, I was really surprised at how extremely frowned upon it was in the religious, specifically Catholic community. Some people said they grew up thinking it was demonized, taboo, sinful, dirty, or damaging to themselves. And although there's still a stigma surrounding women and masturbation, many of the responses that we received indicated that it's becoming normalized and accepted nowadays. Lastly, we chose the topic of masturbation because it's important for us as healthcare professionals to be informed. Some specialties may expect more questions about masturbation than others, but it still applies to all professionals to be prepared, educated, and comfortable on the topic so they can address these intimate questions appropriately. And by being able to discuss sexual education with their patients, they'll also be able to improve the relationship between the patient and the provider. So with all things considered, this project has definitely taught us that masturbation, its benefits, and the stigma surrounding it is an important topic for us as future healthcare professionals to be educated on.